sometimes it's just nice to have that face-to-face interaction, even if it's just over the computer for the moment. That is what we have to work with. This is Sue Mobley. She is a dental hygienist with Palmetto Smiles of Beaufort, and we are going to be talking today about the world of telemedicine, specifically teledentistry, how her side of things is being impacted in their private practice by all of these things that we're seeing now. So for those of you who pop on, if you could just give me a quick thumbs up, let us know that you can hear us okay. That would be great. And then we will just go ahead and get started. So Sue, welcome. Thank you so much for joining today. Why don't you tell them a little bit about who you are, what you do, and how you got into what you do?
Great. Well, Daniella, what's that?
I said the short version.
The short version, yes. Well, first, thank you for this opportunity. I think this is wonderful what you're doing for the community, and just the whole concept of trying to get everyone to remain calm through all of this craziness. So I am dental hygienist, like you said. I'm from Boston, Massachusetts, and I've been here in Beaufort for about 20 years. The office that I work in now is a neuromuscular practice. We do some beautiful general dentistry, cosmetic as well. But Dr. Jennifer Wallace is a neuromuscular dentist, and we kind of run the gamut on that. The changes that we've had recently, of course, have scaled back a lot of what we're doing. Obviously, no cosmetic treatment at this time. The ADA has recommended that we scale back to just urgent care. But we're taking a lot of the same precautions that you hear people speaking of with pre-screening before anyone comes in. We hardly ever have patients in the office right now, actually. We're doing a lot of teledentistry. So virtual, just like the conversation we're having here, being able to help patients that way, kind of almost like a virtual triage to see if they actually really need to see the dentist or not.
Right. Now, you've mentioned that this is a different platform. So Zoom is the one everybody's talking about right now. And we know that there have been some privacy issues and questions and concerns with Zoom. So you use something that is very secure. Is that right?
Yes. Teledent is 100% HIPAA compliant. So it's a much safer way for patients to talk to their caregivers. And they're using similar platforms in medicine, and they've been around for a while, mostly used for provider to provider discussions. But they've modified the platform so that we can have face-to-face with patients. And that's been very, very useful recently.
So that's in the day-to-day, of course, for the questions of sort of, I'm having this pain or this sensation or something like that. So they can talk to you and talk through that in a virtual way. But what about for those things that can't be handled virtually? What actually counts as an emergency right now? Because I know that you're really trying to stick only to those things that really must be done in office. Right.
So there's the black and white of what the ADA considers to be an emergency, which is usually if someone is in pain, if there's active infection, and they need immediate care. So some of those things, even if they are in pain, we can handle them virtually, prescribing medications, and so there's safe ways to do that. So the things that normally need to be handwritten can be dealt with directly to the pharmacy. So the patient chooses their pharmacy, and we can send it wherever we need. So deciding whether or not they actually need to come in the office comes down to a decision between the doctor and the patient as to how to best manage their pain. And if it's not just a prescription, and it's not, as we call palliative care, not something that we can advise them what to do over the phone, then we do need to see them in the office, and we do that as safely as we can. So there's no waiting room anymore. Patients wait in their car and they text us when they've arrived, so we don't ever have anybody in the waiting room, and we'll meet them at the door so they don't have to touch doorknobs and go directly to the chair where they will be treated. And so we're wearing all of our PPE equipment and wiping things down like crazy. And at the same time, as you said, trying to help patients remain calm. And so sometimes when you greet them with a ton of stuff covering your face, if it's not someone who doesn't already know you, it can be very off-putting. So we try to work around that, making sure that we show lots of smiles before they're close to us.
Yes, that's perfect. So talking about the different types of dentistry that you do, and we'll just touch on this very briefly just so that our viewers know exactly what it is that you specialize in. So you have general, which I'm going to just safely assume our viewers understand what that is. Cosmetic is kind of obvious. What is neuromuscular dentistry, and how does that differ from general dentistry?
Neuromuscular dentistry is more of a holistic way of looking at dental care. Mm-hmm. It focuses on what the whole system is doing, the muscles, the joints, the skeletal system. So when Dr. Wallace is evaluating someone who has pain from TMD, mm-hmm. temporomandibular disorder, mm-hmm. The best way that she has found to treat it is by looking at the whole system and not just adjusting a couple teeth to get the bite necessarily even, mm-hmm. but looking at what is going to happen to the muscles around the joint when you adjust those teeth. Mm-hmm. So traditional orthodontics will straighten teeth, and neuromuscular orthodontics will actually fix the bite.
Yeah, that sounds like a really important difference. So it's really, as you said, it's more holistic. It sort of takes into account the system as a system, right, as a whole, instead of individual parts that maybe in the past we didn't think worked together necessarily the way that we now know they do.
And it's amazing the way things change over time. Recently, we've been dealing with a child who has a tongue tie, which is quite common. And if it's caught when they're very young, which usually it isn't unless there's a speech impediment. Mm-hmm. So this was let go, and now the child is 9 years old. And because his tongue has been kind of tied to the floor of his mouth a little too tight, it hasn't allowed the tongue to do what it needed to do in the development process. Mm-hmm. So the tongue is supposed to be pressing on the floor, on the palate,
right,
and helping it to expand. So the buccinator muscles push in, and the tongue pushes up and out, and forms a nice shallow palate. Mm-hmm. If the tongue is sitting on the floor of the mouth because of a tongue tie, then the cheeks win. Mm-hmm. And the maxilla, the top of the palate, becomes very narrow and tall. And as it gets taller, it closes off some of that nasal palatine space, mm-hmm. which is very important because that's a lot of your nitric oxide is produced in the nasal palatine space. And nitric oxide is used in every cell in the body. Mm-hmm. So essentially this child has been breathing through his mouth more than his nose. Mm-hmm. And we need to reverse that. And we can do that through neuromuscular orthodontics, not just snipping the tongue, but actually teaching the tongue what it's supposed to do, which is basically physical therapy. It's called myofunctional therapy. Mm-hmm. And that's how we retrain so that once Dr. Wallace is able to get the teeth where they need to be and the bite where it needs to be and all the muscles in harmony, then we can make sure that the tongue doesn't undo all that, because the tongue is a very strong muscle.
Right. At least it should be in the course of development, as you say. So that's fascinating. And it's not something I think a lot of people think about. And if their dentist isn't practicing in this way, they're probably not getting this information from anywhere, nor do they know that they need to. So talk to us a little bit about what are you seeing on your side of things as far as the regulatory world and being allowed to practice in certain ways?
Well, in light of current conditions, the recommendations from the ADA are to limit as much as possible any patient interaction. Mm-hmm. And so that's where the teledent has really been a huge tool, because it's one thing to talk on the phone to someone and get a feeling for what's going on and how you can help them, but face-to-face is so much different. And I feel like right now, the way that people are feeling very isolated, that mm-hmm. having a face to talk to and not just a voice really mm-hmm. helps with keeping things somewhat normal. But as far as the actual regulations, it just comes down to what's an emergency, and that is mm-hmm. often a decision that's made between the doctor and the patient.
Now, speaking of emergencies, what if it's someone who is not currently your patient? Are you able to see them now?
Yeah, excellent question. And there have been some changes recently to the regulations and state regulations. So if someone contacts Dr. Wallace through our website and they're not a South Carolina resident or they're not an active patient, it changes a little bit on what we can do, but not much. She actually has patients that travel from all over the Southeast to see her for her specialty, and that's been going on for years. So we have we've been doing this for a while, but now it's kind of a different need. But it always starts with care. Now always starts with that triage, that screening, virtual consultation. And if it's not a patient of record, then we have ways of getting their registration and health history all online in a safe and secure way.
So if they need you, you can make it happen.
Absolutely.
Okay.
Absolutely. And that is really what Dr. Wallace wants, to make sure that her patients know that we are here to take care of them through this. And even if it just is sometimes it's just a reassuring phone call.
Absolutely. And I'm sure that a lot of those are being made right now, and maybe a lot of those teledent meetings too. So what is one thing that from the dental perspective, you would say to our viewers right now that they can be doing, whether it's a health maintenance kind of a thing or something, to keep them out of that emergency situation? Don't let me prompt you anymore. Just what is one thing you would say to our viewers from your perspective right now?
Well, there are plenty of patients that right now are actively currently in treatment for different things, and so there's going to be challenges there. We're going to be playing a little catch up when we get back up and running. So my best recommendation is to really do your homework. Make sure you're taking care of what you have. If you notice any changes, increased bleeding, anything like that, and then ramp it up some. When we do have patients come into the office for urgent care right now, one of the things that we're doing a little differently is that we will have them do, we've added hydrogen peroxide to their pre-rinse. We always do a pre-rinse before any invasive procedure because it cuts down on the bacterial flora in the mouth and therefore cuts down on how much the patient's immune system has to handle when we start kicking up all that dust. So we've added the hydrogen peroxide at the recommendations of the ADA because apparently that is a good weapon right now. I will say as a side note that normally hydrogen peroxide is not recommended for regular use in the mouth because it kills some of your good guys as well as your bad guys. So it can shift that flora, and we do see problems from that over time. So I would say maybe a little bit of hydrogen peroxide, and I never thought I would say that.
Right.
So 50-50 hydrogen peroxide and water, and maybe with that before you are going to be in a setting where it may be a little bit more difficult to do social distancing.
So being extra vigilant, in other words, and just taking special care to stay out of those facilities, because as we know, as with just the sort of general health population right now, I mean, people still have things that are not coronavirus, and it's getting harder and harder to see the practitioners that you need to be able to care for the things that are completely unrelated, but that the human population still has to deal with. So it's a really interesting time right now. But thank you so very much, Sue Mobley Palmetto. I just completely lost the name.
Smiles of Buford.
Palmetto Smiles of Buford. I had it and it just wouldn't come out. But anyway, Sue, thank you so much for being here. And this has been session 5 of the Remain Calm series. If you are watching this live, please make sure to give it a like and a share. Make sure that this information gets out to as many people as possible. You never know who might need it. And sometimes it's just nice to have that face-to-face interaction, even if it's just over the computer for the moment. That is what we have to work with. So please let people know if you think that there's some value here that they might enjoy or they might learn something. Please go ahead and share this information with them. And if I can ever do anything for you, as always, just let me know. Everybody have a great day. Sue, thank you for being here.
Thank you, Daniela.